This is our clinic's 3-point first aid for pain. With the current ongoing situation with the coronavirus and GP appointments at a premium, we have decided to offer our guide for pain relief. Although the research is a bit sketchy, if you've ever seen a sports person on TV, if they get injured, they put ice on straight away, initially to reduce pain and secondary to reduce any swelling. The advice varies a bit, but we recommend only 10 minutes on with a cold pack and at least half an hour off. Otherwise it may have the opposite effect. You can repeat this as much as you like throughout the day depending on the ability to apply the cold pack and how much pain you're in. We recommend having a bit of tissue paper between the skin and the cold pack. This stops you getting a cold burn, and if you get a cold burn that will certainly take your mind off your injury. If you want a hot bath, hot shower because it feels nice, make sure when you're dry you start cold packing again. Tip number 2. Most people go straight for an anti-inflammatory when they initially get injured, like ibuprofen, ibuprofen or naproxen. However, these theoretically should not be taken for the first 48 hours of an injury, as it slows down the body's natural healing process. So after an initial injury, you should take paracetamol-based medication. Take it every 4 hours and it takes at least 5 consecutive doses to have its full effect. After 48 hours, you should or can then also introduce your anti-inflammatory medication. We strongly advise you to consult your pharmacy or your GP to make sure you can do this, as certain health and medical conditions will not allow you to follow these guidelines. This is even more important at the present time, as there is some evidence that anti-inflammatories may have a detrimental effect with the coronavirus. Tip number 3. The last thing we would recommend is to keep mobile. It used to be said to have 6 weeks bed rest if you'd hurt your back, but this has been proven to have a negative effect. So when you're injured, we suggest try and walk around the house or the garden pretty much on a regular basis. It doesn't have to mean going on a 5-mile walk. My general guide is if you've been inactive for 30 minutes, then try and have a 30-second walk. I hope you find this helpful. If you've got any queries, then please make contact with me or message me.